being a nurse in the Continuing Healthcare Team, the job allows you to spend time with people and getting to know people. By the end of the assessment, you have a good picture of not only about what someone's needs are, but who they are as a person.
I've worked for the NHS for nearly 30 years now, and it was only until I came to CHC that I understood how it interacts with the local authority, care providers, voluntary services, and seeing that at a kind of commissioning level has really benefited me as a nurse.
It's a different kind of role compared to a lot of nursing roles in the NHS. What we do is around personalisation and just empowering people to be kind of in control of their own lives and their own care and support. And I think seeing people flourish with that support is brilliant.
It's a lot of assessment work, but actually you get to meet so many different people in care agencies and work with safeguarding colleagues. It's so vast and so broad, you get so much experience.
It's kind of a skill and knowledge that you can take on and continue to use, not only in this role, but other roles as well.
I really enjoyed it, and so it made it really easy decision to stay. And I would say there's not a day goes by when something different happens that I think, oh, that's not happened before. So it's really, every day is still a school day, as they say.
I think people often think you need to know a lot about the policy and legislation around what we do, but that is teachable. We don't expect people to come armed with knowing all about case law and legislation. We just need people to have really good assessment skills, be able to talk to people and show empathy and compassion.
We have a great team that I would say are really supportive.
Why I enjoy working in the team and why it works for me is actually that having children, quite often things occur that's out of your control, but with this job there is flexibility.
The first real big difference was the work-life balance that, I've done nights for 20 something years, to suddenly not have to do nights was amazing. In acute settings, it's always been, you see a snapshot of somebody, but to be able to see somebody going from a hospital setting home to having a really safe and secure package of care and seeing them thrive within that package of care and being able to do and live their life, I think that's really beneficial, and I do get a lot out of that.
You need to kind of be able to pick out the really important details. You do need IT skills. You need to be quite good at typing, which sounds silly, but there's quite a lot of report writing. So you do kind of need to be a bit IT savvy. You need to be able to relate to people. You're working with people who have a learning disability, people with complex mental health conditions, people with really complex physical health conditions.
When you have an assessment from our team, you will have, at least an hour, maybe 2 hours of talking to one of our nurse coordinators, all about yourself. You might think, oh, actually, there are things I need to address around my health, or actually, I'm not having the care delivered in a way that's best helping me. So it may not be that you are directly benefiting from continuing healthcare, but you may still benefit from the assessment.
Definitely suggest coming to join our team and give it a go, because you don't know unless you try it.
I would definitely recommend CHC.